we have Jay Caston, who's the COO of the World Games, Dr. Sarah Nafziger, who is Vice President of Clinical Support Services for UAB Hospital, Irfan Asif, who is the Chief of UAB Sports Medicine, and Mark Wilson, who is the Jefferson County Department of Health Chief Health Officer. They're going to be here to answer some questions today and give some statements about the upcoming care for athletes and spectators here during the World Games. So we're going to start today's briefing with a welcome from Mr. Caston, and then we're going to go to Dr. Asif for some opening remarks, and then we're going to go straight to questions for him on the care for athletes during the games. Dr. Asif has another engagement at noon, so he's going to have to jump off the call early, but we want to give you an opportunity to ask any questions of him before he needs to leave. And then after his Q&A, we'll get with Dr. Nafziger and Dr. Wilson and give them an opportunity to provide some opening remarks and then take your questions for them and Mr. Caston. But with that, we'll open the floor to Mr. Caston to welcome everybody in today.
Well, good morning, everybody. It's a pleasure to be here. We are 8 days away, and it's exciting to see everything starting to come to life. Hopefully, people have had an opportunity to drive around town and start to see everything that's starting to sprout up from the ground. It's going to be an exciting 10 days as Birmingham welcomes so many from all over the world. An obvious important part of that in conducting big events is ensuring we deliver top-notch medical care, especially where needed. We are fortunate here in Birmingham to have some of the best doctors and health officials in the world who have been working on the plans for the World Games for years at this point. We all want to provide a once-in-a-lifetime experience that's both safe and enjoyable for everyone. And with that, I just wanted to recognize and thank everybody at UAB Medical, Andrews Sports Medicine, Jefferson County Health Department, as well as the many other stakeholders who've been working to ensure the safety of these games over the next couple of weeks. We're proud. We think we're going to represent Birmingham and show Birmingham off to the world, and we're just excited to get this party started. So with that, I will kick it back.
All right. Thank you very much, Mr. Caston. Dr. Asif, would you like to provide some opening remarks?
Sure. No, excited to be here, and I've had the pleasure to work with Jay over the past 2.5 years. Again, my name is Irfan Asif, and I lead the Sports and Exercise Medicine program here at UAB. It's an honor to work with Jay and everyone else to care for these 3,600 athletes across 32 sports and 25 plus venues. I'm one of the co-medical directors with Dr. Jeff Dugas, and UAB will be helping to provide medical care in many different settings. On the field of play, we will be working with Andrews Sports Medicine Group, and UAB will also be providing care outside of that in the telemedicine space, urgent care, the emergency room, as well as in the hospitals. We will be looking at how we can best help athletes care for their orthopedic conditions, any heat problems, concussions, heart issues, as well as mental health concerns. Really want to thank everybody for coming together to make this event a success, including our emergency services personnel, the city and state officials, local hospitals, as well as the World Games, and all the volunteers that are here to make this a success, both from the medical side as well as from an athletic side. And I'm happy to take any questions that people have.
All right. Thank you very much, Dr. Asif. While we're waiting for those questions, can you just sort of go into a little bit of detail on the logistics for preparing for something of this scope here in town, and just what all has gone into that?
Yeah, we've been planning for the past 2.5 years and drawing on the experience of a number of individuals. For us, we've taken care of different events that might mimic individual events that you might have in the World Games, but putting that all together can certainly be a challenge. So we've been working, we actually started before the COVID pandemic. And as you can imagine, when the COVID pandemic came in, we had to think of different protocols in place, and even how we met as a group monthly and bringing people together. That was also a challenge. So we met as a leadership team with Jay, Jeff Dugas, myself, David Randall, Joy Hammond, Lisa Warren. We met monthly at the beginning and then started to meet every week. We've also pulled together a spectator team, which includes the emergency department, led by Joel Evans and Bobby Lewis and other emergency department leaders. We've pulled together a team from the psychiatry department here, looking specifically at mental health. We've also focused on language services, pulled together folks who are in charge of getting supplies for athletes and spectators. Again, lots of planning that's been going on over the past 2.5 years. And again, I think we're well equipped for the things that we will probably see during the next couple of weeks.
All right, thank you. What will the medical team sort of look like at any particular venue?
Good question. So at the venue, there are going to be a whole host of teams that are going to be present. It'll likely be that some of the teams that are more highly resourced will have some medical personnel that will accompany the teams with them. That might include, for example, an athletic trainer or some physicians. We'll be providing field of play evaluations with physicians, athletic trainers, and then also have nurses on hand for the games. There's also a chiropractic group called Fix that'll be working with us for pregame and recovery needs for the athletes. So you'll see those different teams working in conjunction with EMS and other officials to help on the field of play. And then if an athlete has an issue off the field of play, that's where we pull in some of our other services where we can work with them directly, use our telemedicine services through UAB, send people to urgent care, to the ED, or to the hospital as needed.
All right, and then lastly, what kind of injuries do you sort of anticipate with athletes from event to event, that kind of thing, or is there certain things that are a little more common than others in these types of events?
Yeah, you're correct. It probably will vary from event to event. For example, there are some things like billiards or drone racing where you may not have as many injuries. But if you think of sumo, lacrosse, and some of the other contact sports, you might have orthopedic concerns. So muscles and bones that might have some injuries. In particular, I am concerned about the heat. We've seen the weather here over the past few weeks with some temperatures that near 100 degrees. We've been taking care of the USFL athletes. I'm the medical director for the USFL League, and on the field this past weekend, for example, the temperature was near 140 degrees on the turf. So I think heat is a big concern. I would say that that's both for the athletes as well as the spectators. So I'd really encourage people to stay hydrated and not to take that lightly. I think that that's something that we need to be prepared for as a medical team.
Perfect. And is there, if in terms of athletes that are coming into the town who may not be used to Alabama weather and the heat, humidity, are there any specific things that they should be watching for or doing as they arrive, just to be sure that they're ready to perform at a peak level?
Yeah, for the best thing to do for athletes that are coming from an environment that may not be like this is really to get acclimated to the weather. So any athletes that can travel early and get used to the weather, that's the number one thing to do. Obviously, staying hydrated is important both before and during and after the event to make sure that you can optimize your health. I think for athletes that they're pretty high level and trained for this sort of thing at the World Games level. But certainly if people start to feel lightheaded, dizzy, feel like they're going to pass out, those are things that we'll closely watch for in case we need to remove somebody from the field of play.
All right, perfect. And we have one more media question. This one's going to, Lisa Crane, can you unmute and you can ask Dr. Ossoff your question?
Hi there. Thank you so much. Can you hear me okay?
Yes.
Okay, great. I know that you guys have obviously been thinking about the athletes coming from all over, but even I would think more of a concern are all those spectators who may not be as healthy as these athletes, and with the heat and then you throw in a pandemic. How have you prepared for the potentially tens of thousands of people who will be out in July in Alabama? And some of these events are 9-hour events. So I can just anticipate a lot of heat related issues. And then with groups like that, also COVID and pandemic concerns.
Yeah, I think Dr. Nofziger is going to speak to some of that, but just to give you a quick overview, we engaged our emergency department fairly early in the process. They are used to taking care of large crowds, such as at the Talladega track. And so they have considerable experience with this. We will have emergency medicine personnel, as well as nurses and other volunteers that'll have first aid stations for spectators. And we'll also be encouraging them to stay hydrated. As you mentioned, the heat, as well as the number of hours during the day that people might be outside. I think those are things that we need to watch for. We'll have ice available for folks, as well as cooling stations. So those are some things that we're trying to do to help prevent heat illnesses in the spectators, in addition to the athletes, as we talked about.
All right. Thank you, Lisa. And thank you very much, Dr. Ossoff. I know you need to get moving to your next event, but thank you for joining us. We appreciate it.
Thank you for having me, and looking forward to seeing everyone here. Thanks.
All right. Thank you. Dr. Nafziger, would you like to provide a few remarks, and then we'll go to Dr. Wilson?
Sure. Thanks. That was a great segue. So I'm Dr. Sarah Nafziger at UAB Hospital, and appreciate this opportunity to address you and share with you the preparations that we've been making to welcome the world to Birmingham. As you know, UAB Medicine is the official medical provider for the World Games. And so part of that, you've already heard from Dr. Ossoff about the athlete care and the things that we've been doing to prepare to care for the athletes. But we've also been working to prepare to care for the spectators and other visitors who will be in Birmingham and the surrounding areas to enjoy all the things that we have to offer with the World Games. So a lot of preparation has gone into this, and we want to share what those are right now. So as Dr. Ossoff shared, at each venue, we'll be setting up a medical tent or some other type of medical area that will be set up to provide care for spectators. So we're not just thinking about the athletes, we're thinking about the visitors as well. Each one of those areas will have medical personnel that includes doctors, nurses, nurse practitioners, maybe some physician's assistants who'll be there to be ready to provide care for people. Now, what kind of care are we going to have there? Well, you know, EMS normally cares for emergency situations out in the public, but with this many people that we expect, we want to be there to augment EMS. So we're going to be there to take care of those serious things that could happen and to work with our EMS partners who we've worked together closely with to plan for this event. So we're not trying to take their place, but we're going to be there to augment and work with them for those serious emergencies. So things like cardiac arrest, serious injuries, we're going to be there to work with them in transition care so that we can get those patients transported to local emergency departments as needed. But we're also going to be there to take care of other things, because our goal is to keep people there at the venue and there at the games. And if they have a minor medical issue, we want to make sure that we can take care of that and maybe get you back out there so you can continue to enjoy the games. So things like minor cuts, bruises, scratches, strains, you know, minor illnesses and injuries, those are things that we're going to be there for. And then, of course, taking care of heat-related illness and all the things related to that. So we're going to have cooling stations, cooling fans, things of that nature to help people get cooled off if they get a little too hot out in the heat. And we want to make sure that we're there and available to try to keep them, get them feeling better so that they can stay and enjoy the events. Now, this is something that it's a big undertaking, as you've heard described, and UAB's taken the lead to set this up. But I did want to take a minute to give a nod to our partners. We've had a lot of community partners that have stepped up and said, hey, we're going to help you with staffing for this, because this takes a lot of people to staff. So we have partners from St. Vincent's, from Medical West, from Callahan Eye Foundation, from I'm going to look at my list. I don't want to leave anybody off. From Grandview, Brookwood Baptist, Baptist Montgomery, and then from several of the schools, we have students from the physician assistant program at UAB, and from several schools of nursing, including the UAB School of Nursing, the Jeff State School of Nursing, Sanford School of Nursing, and Bevel State School of Nursing. So a lot of community partners, and I'm sure there's others that I missed, who are going to help us out at these venues so that we make sure that we have plenty of folks there on hand to take care of whatever medical event that you have, and hopefully try to keep people there at the games. I'd be happy to take any questions in a few minutes about anything else that you may want to ask.
All right, perfect. Thank you so much, Dr. Nafziger. Dr. Wilson, would you like to have some remarks as well?
Yes, thank you. Our health department, one of our biggest roles is going to be in the area of food protection and safety. All the food vendors for the World Games have been pre-approved and prepared way in advance to make sure the food supply is safe from the time of preparation to the point of service. We've actually brought in the U.S. Food and Drug Administration for some extra support, an extra level of protection, and they will be hosted here at our health department. For the Oak Mountain events, which are in Shelby County, we will be joined by food protection staff from the Alabama Department of Public Health. We're also making sure all the restaurants in the vicinity of World Game events are up to date on their inspections. And some people may not know this, but our health department also conducts health inspections of our area hotels. So we're making sure those inspections are up to date in the vicinities as well. Regarding COVID-19, I do want to make sure everyone is aware that Jefferson and Shelby counties are currently at a high COVID-19 community level for the Centers for Disease Control. This high level rating is based on the numbers of COVID cases reported, as well as the number of people hospitalized and the hospital bed capacity in the area. This really shouldn't be a reason that the games should be disrupted or that people can't enjoy the games, but we do want people to pay attention to the CDC's community level, which is available on their website, and take the appropriate precautions as recommended by the CDC. So for a high community level, which again is our current status, and it may be the status during the World Games, we don't know yet, masks are recommended for all indoor public spaces. So everyone's encouraged to follow those recommendations to make sure we're all safe and everything can be successful. And of course, everybody is encouraged to make sure they're up to date on their COVID-19 vaccination, including a booster if eligible. I also want people to know that we've just brought in a COVID testing company called Easy Testing to offer COVID-19 testing at a convenient outdoor site, which is located on the corner of 18th Street and 1st Avenue North in downtown Birmingham. They started testing yesterday, and they'll be providing testing to anyone who requests it on Mondays through Saturdays, 10 a.m. to 6 p.m. This testing is free, and there's no requirement for ID, for legal status, or health insurance. The test site's available easily by public transit, and they do accept drive-ups and walk-ups, but people are encouraged to pre-register at their website. It's called easytesting.com. That's easytesting.com. Also, for any other information about this testing site or other testing or vaccination information, we continue to have the Jefferson County COVID Information Call Center available at 205-858-2221. As always, our health department is here as part of this team, happy to help, and we're available to help assure that the World Games are safe and successful. Thank you.
All right, thank you very much, Dr. Wilson. Appreciate that. The first question that we have is going to be from Mary Scott Hodgen with WBHM, and this is for Dr. Nafziger. She's asking if for folks who do need further treatment and can't be treated at the medical tents, how is UAB preparing for the increased demand in its hospitals, and especially as we continue to see some COVID cases coming in?
Yeah, that's a great question. So we're hoping that we'll be able to take care of a lot of things out at the venues, at the medical sites that are set up there. But of course, everything won't be able to be cared for there. So things that have to go to hospitals, things where people need a little more advanced care, maybe they need to go to an urgent care. Certainly, we will be recommending that. And for those that require emergent transport, we'll be partnering with our EMS partners for transportation to the local emergency departments. So not just UAB's emergency department, we'll be, our venues are set up all over the place. And so we'll be going to the closest facility, of course, with the patient's input into that. So definitely the emergency departments will still be utilized, but we're setting all this up in an effort to hopefully not overload the local system of emergency departments and urgent cares. In addition to this, we also have enhanced some of our e-medicine offerings through UAB Urgent Care. So we do have some enhancement of those offerings that are available throughout the games. And we can provide you some information on that so that you can get that to viewers. But definitely that's something that we're working on enhancing so that maybe people don't have to physically go into an urgent care or to their provider's office, or if you're a visitor from out of town, so that people can access those offerings and maybe avoid a trip into an urgent care or to an emergency department. So in addition to all those preparations, some things that are going on behind the scenes at UAB Medicine is we have set up our incident management team for COVID at UAB Medicine, and we'll be standing up our UAB Medicine Command Center so that we have that available and all those resources at hand in our hospital so that we're ready just in case we do have a surge of patients. If we have a lot of people who need to come to the hospital, need to access care, that way we'll have our resources set up and available so that we can expand our services rapidly, bring in more resources if needed to care for a surge of patients. So that's just a few of the things that we're doing to get ready to make sure that we can welcome the world here safely.
Perfect. Thank you, Dr. Nafziger. Dr. Wilson, this question is from Amy with AL.com. Is there any concern about monkeypox, and does the health department have testing and contact tracing capacity if cases emerge during the games?
Thanks for the question, Amy. Yeah, monkeypox really shouldn't be a big concern as far as the World Game activities go or being a spectator. It is a public health concern. We have not had any cases detected yet in the state of Alabama. That doesn't mean they don't exist. There have been in Georgia and Florida. But we are prepared to do testing and contact tracing, and we're ready to do that if needed, as well as the state health department.
All right. Thank you very much. Dr. Nafziger, could you also just touch a little bit on the continuing treatment and care for current patients that will be taking place at UAB as well and across our platforms? Don't want people to think that we're not going to continue to care for those outside of World Games as well.
Absolutely. One of the things that has been a big challenge for us going into World Games is UAB wants to make sure that we stay open for business as usual. So no procedures are being canceled, no appointments are being canceled. We are business as usual for taking care of patients and providing the services that we normally provide at UAB. So I'd like to be very clear about that. That is our top priority right now, is making sure that we stay open to continue to provide the care that we normally do. So that is part of what's made the preparation for the World Games so challenging, is we wanted to make sure that we can continue to do the things we do every day in addition to preparing for the World Games. So to make that happen, we've called in extra staff. We have folks who are coming in extra, working overtime. We have, as I mentioned, a lot of our partners in the community who are contributing and pitching in so that we can make sure that we provide all of our normal services, things we do every day, in addition to this extra care for the World Games. So that's a great question. Thank you for asking.
Of course. Another question we have too is, what types of illnesses and injuries can spectators have treated in the medical tents outside of some of the heat-related issues?
Yeah, so, well, first of all, I'm going to talk about heat related first, and we'll talk about other things. So y'all may have noticed, but it's really hot outside. I don't know about you, but I have been in a continual state of inelegance lately. Anytime you walk outside, it's really hot. So that's the most common thing that we anticipate is people come to see us who maybe are not accustomed to the heat or who maybe didn't plan well for it. So we will have cooling resources available, fans, ice, things like that. And hydration. So there are a few things that people can do to prevent themselves from becoming a patient. And I wanted to talk about that briefly, and then we'll talk about the other things. So the things you can do to prevent from having to come to see us is, first of all, take some precautions. Hydrate yourself. That's the number one thing. You want to make sure that you're well hydrated before you come visit the games. And while you're here, you want to continue to hydrate. If you wait to get something to drink until after you're already thirsty, you've waited too long. So we want to emphasize the importance of people making sure that they're very well hydrated. Now, if you look to plan ahead for what to bring to the games, one of the things that you can bring with you is a plastic water bottle that is clear. And so I would encourage everybody who's planning to come to the games to bring a clear plastic water bottle full of water with you, because you're going to want to stay hydrated while you're out there in that heat. The second thing is think about sunscreen, because guess what? If you're like me, I walk outside and get a sunburn in about 30 seconds flat. So you're going to want to think about sunscreen and bringing sunscreen to reapply. Just, having a sunburn is miserable. It's no fun. It increases your water losses. And so you want to make sure that you're preventing sunscreen. So you can do other things like wearing a hat to keep the sun off your face and head. Wear light, loose clothing so that you can make sure you're not overheating from your clothes, trapping too much body heat in. Those are the big things that you can do to prevent from having to come see us. But if you do have to come see us, we'll be happy to greet you with a smile and help you out. Now, thinking about some of the other things that could happen, we hope that you don't have injuries, but certainly injuries do happen. So we anticipate we'll probably have some people who have bumps and scrapes and bruises and falls and things of that nature. So we're prepared to take care of those things that you would typically go to an urgent care for. Those are the type of things that we're really preparing for and anticipate that we'll see a lot of. We'll have some over-the-counter medications for people who might have minor discomforts, headaches, stomach upset, things like that. In addition to all those things, though, we're preparing for things that are a lot more serious. So cardiac arrest, stroke, things of that nature that are much more serious, major trauma. Those are things that we are preparing for also in conjunction with our EMS partners. And so we're really trying to think about all the things that could possibly happen while you're out there. We want to make sure that we provide those things. One thing that we will not have is we are not going to offer COVID testing at these venues. That is not the location to go to get a COVID test. That is being offered as Dr. Wilson mentioned and referred. The health department is setting up a COVID test site that'll be available to the public. So for visitors coming into town. And then of course there are COVID testing resources all over the place right now. You can get free test kits sent to your home. You can get them at local pharmacies, and a lot of local providers provide COVID testing. But that is one thing that we will not have. So I don't want people to think that they could come to these spectator sites to get COVID testing. That is one thing we will not do. But we will be there to provide care for minor illnesses and be there to take care of major emergencies as well.
Dr. Nafziger, one other thing too along those lines is that there are some things that we're doing, I guess, ahead of this, right, to sort of spread heat illness and hydration information to visitors as they come into town, in hopes that we don't have to see some of the heat-related stuff in the tents, that sort of thing, correct?
That's right. We've partnered with the World Games and several of the local hotels and other venues to provide some of this information to people who are coming into town. So some information about heat illness, how to stay hydrated, about how to prevent sunburn, things like that for people who may live somewhere where that's not as much of an issue. So a lot of that information has already been provided and is being provided to people even before they get here, and at the local area hotels and through ticketing resources. So a lot of that information is being distributed in hopes that we can have people prepared so that they're not surprised when they get here by the heat that hits you when you walk out the door of your hotel.
All right, thank you. Dr. Wilson, Mary Scott is asking how many people can be tested daily at the easy testing site recently set up?
Yeah, Mary Scott, I don't have that exact number. I know they did about 24 yesterday after starting sort of midday. But I think they have the capability of doing a couple hundred a day at least. It's a rapid test that they're offering where people can, after about a 15-20 minute wait, they can get their results on site.
All right. Thank you very much, Dr. Wilson. Thank you, Mary Scott. I don't see any other questions in the chat, and no other questions have been submitted. Jay, do you want to close us out with anything? Any just sort of final thoughts about what's coming here in the next few days and how excited we are for it.
Yeah, absolutely. Thank you. And thank you for everybody that's contributed to this. It really does take a village for such a large event. And as we've said with a lot of different things, whether it be security, medical, with big events come big responsibilities. And I couldn't be prouder of the greater community and the partnerships that have came together that hopefully even beyond the World Games continue on as Birmingham continues to grow and bring in big things. So again, just want to thank all of our partners and thank you for this opportunity. And we look forward to hopefully seeing everybody across as many venues as possible over the next 2 weeks.
Awesome. Fantastic. Thank you so much, Jay. Thank you, Dr. Nafziger, and thank you as always to Dr. Wilson. And members of the media, we've been recording this as well, so we'll be sure and send this out to you at some point here as quick as we can this afternoon so that you can use it today and beyond. Thanks again for everybody, and look forward to what's coming next week.
Thank you, Tyler.
Yep. Y'all have a great day.